Mr. Speaker, I'm in strong opposition to the rule and the bill before us today. In 2008, I introduced legislation to create a Prevention and Wellness Trust Fund. Much of what I see in the Prevention and Public Health Fund resemble the goals in my legislation. I introduced the legislation and fought for these preventive care provisions during the Energy and Commerce Committee debate on the health care law. I believe investing in preventive health care is vital to helping Americans access the care they need to stay healthy, reduce their health care costs, and ease the burden on our overcrowded emergency rooms. Mr. Speaker, we spend more than $2 trillion annually on health care, more than any other nation on earth. Yet, tens of millions of Americans still suffer from preventable and chronic diseases. In fact, approximately 75% of the nation's health care expenditure is spent on treating chronic conditions. These conditions account for 7 of 10 deaths in America. For too long, the health delivery system in our country has been focused on only treating people after they get sick, not before. Prevention has been a luxury, if not an afterthought. Studies have shown that regular access to primary and preventive care can help keep people healthier, help avoid chronic conditions, catch diseases earlier, and therefore help lower costs. Sacramento resident Tyler, an active teenager, was a picture of model health. One day, he noticed that he was having heart problems during football practice. Taking precautions, his parents took him to a doctor to run tests and found that he had a cardiac abnormality. Today, after taking the necessary preventive steps, Tyler is healthy. Thankfully, he sought preventive measures early, which kept his condition from worsening and likely saved his life. Not every story ends as happily as Tyler's, though. Millions of Americans every year are diagnosed with chronic diseases because they didn't have access to preventive care. That is the focus of this fund, to improve prevention. This funding will reduce individual and taxpayer costs while saving lives. However, that fact is being overlooked by my colleagues on the other side of the aisle. This bill before us will have a devastating effect on the future health of America, both in terms of our physical health and for our fiscal responsibility. In order to truly improve both our health and our health care in this country, we must focus on prevention. I urge my colleagues to oppose this rule and the underlying bill, and I yield back the balance of my time.